Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hello everyone, this is Dr. Jacobs. In this video, I'm gonna answer the question, do I have magnesium deficiency? But before we do that, we need to understand what is magnesium, the benefit of having magnesium on a daily basis. Also, I will just go quickly over the symptoms of magnesium deficiency, and then we'll answer the question, do I have magnesium deficiency? I'm gonna go over 5 causes of magnesium deficiencies. So if you have these causes in your diet or in your life, there's very high chance you have magnesium deficiency. Why? Because our body does not produce magnesium. We have to get it from outside sources like food or supplements. So before we start, we need to understand the difference between macro mineral versus micro mineral. So macro mineral is any mineral that our body need more than 100 milligram daily. These consider essential minerals that we really need a high dosage of those minerals for our body to function normally. If we don't have that, we'll have a lot of several symptoms, and if we have it for a very long time, that could lead of a lot of health issue like chronic fatigue, chronic migraines, cancer, or other health issue. Micro minerals are trace mineral, and we just need on average less than 100 milligram daily. So magnesium is considered actually a macro mineral, so it's very essential. We need high dosage of magnesium compared to the micro mineral. It's important to understand that to realize the significant effect of the magnesium in our body. So magnesium is considered the second most abundant ketone, which is actually a positive charge ion after potassium in the body. So really we need a lot of magnesium in our body for our cell to function properly. I'm just going over this very quickly so to get a good understanding of the magnesium, but in other videos I will go into detail of the metabolic pathway and the most important aspect of how it works in our body. So it's required actually for energy production. So most of our cells actually need magnesium. It's considered a cofactor for at least 600 to 800 enzyme systems. So it's basically, if we don't have magnesium, there is a lot of metabolic pathways will not work properly, or a lot of internal chemical actions will not occur because we don't have the magnesium. We need it for energy production. We need it for our muscle and nervous system function. We need it for blood glucose control and blood pressure regulation. Just remember this because I'm gonna come back to this after a few slides. So the magnesium level is about 50 to 60% of the magnesium we have is actually in the bone. The rest 20% in the muscle and 30% in the cells. And in the blood, there is usually around 1% of the magnesium in the blood. And that's what shows you the significant need for our bone health, for muscle health, for nervous system, including the brain and nervous system, peripheral nervous system. So we need the magnesium everywhere. So these are the signs of magnesium deficiency. You're gonna have muscle weaknesses. Some patient could experience tremor, twitching, or cramping. And by the way, when you start to experience any of or combination of those symptoms, that's an indicative that you have the magnesium deficiency for a while. It's not happening overnight. You had it for a very long time, and that's when you start to have those symptoms. Heart diseases, which including heart attacks or high blood pressure and other cardiovascular diseases, very important, and we'll come back to this. There's actually some studies shows that with the patient that has seizure, they actually, some of them, they have actually magnesium deficiency. So that could cause a lot of chemical imbalance in the brain. Anxiety, nausea, vomiting, insomnia. So a lot of these symptoms could be related to magnesium deficiency and magnesium deficiency and other vitamins and mineral deficiency. One of misperception is if I have all these symptoms, I have magnesium deficiency. That could be true, and that could be part true, because usually when you have deficiency, it's not usually one mineral or one vitamins at the same time. When we do comprehensive laboratory evaluation, usually the patient who has deficiency, it's usually in multiple vitamins and minerals, because, for example, magnesium, you need the magnesium to absorb D properly. So if you don't have enough magnesium, your D actually going to be affected, and so on and so forth. Vitamins and minerals, they work together. So if you have one of the minerals or the vitamins deficient, it actually causes a big mess or cascade effect of other deficiency. So to answer the question, do I have magnesium deficiency? I'm gonna go over 5 causes for magnesium deficiency. The more you have of these in your life, the higher chance that you have magnesium deficiency. Well, first, we're going to go over the American diet. Actually, the American diet is a cause of magnesium deficiency, one of the main causes, because it includes high refined sugar and saturated fat, which yield very little magnesium. So in American diet, we don't get enough magnesium. Approximately half, about 48% of US population has been shown to consume less than daily requirement of magnesium. So if you are American or you eat American diet, fast food with the high refined carb, refined sugar, cookie, candy, bread, saturated fat, fried food, there is very high chance that 50% chance that you will have magnesium deficiency, because that food does not have magnesium and actually decrease the magnesium absorption. So that's one of the causes. The second cause is our ancestors actually used to have the ratio between magnesium and calcium in their diet was 1:1. When they eat like fresh vegetables, fruit, nuts and seeds, the hunter and gatherer diet, that is very high in magnesium and actually has a good balance between magnesium and calcium. Why that's important? Because American diet is actually have the ratio of 10 calcium to 1 magnesium. Why that's an issue? Because calcium is actually linked to a lot of health issues like cardiovascular diseases, stroke, heart attack. The other issue is when you have more calcium, it actually causes more magnesium deficiency. There is a relationship between magnesium and calcium. We have to have both of them balanced. You don't want to have more calcium, which is actually, American diet is extremely high in calcium, and I will cover the calcium, why you should not take calcium supplement in another video. But the balance here is very off. So our diet is high in calcium with low in magnesium. That's the American diet, the refined carb, refined sugar, and the saturated fat with high dairy products, compared to not having enough fruit and vegetables, nuts and seeds. So the third cause that could cause magnesium depletion or deficiency is some of the drugs. Actually, when you look at this list, you will see its majority of the drugs could cause magnesium depletion, especially if you are on those drugs for a very long time. And I put here in the red alcohol because it has the same effect as drugs, and it has really severe side effects, not only in magnesium, in a lot of things, and it causes increase your risk of cancer. It's just a lot of health issue in relation to the alcohol. NSAIDs, the pain medication that a lot of people, and I personally, after my cancer treatment, I used to take pain medication on a daily basis. It's like a candy. and that is could cause magnesium deficiency. Antacid, antibiotic, so on in this list. And I highlight the most common ones. Caffeine is actually cause magnesium deficiency, especially after you eat your meal, especially if you eat a balanced meal and you ended up with caffeine, that will deplete the magnesium that you just had from your diet. Cholesterol medication like statin, it also deplete magnesium. Blood pressure medication. So if you are on those medications for a very long time, you really increase your risk of having magnesium deficiency. Why magnesium is important? And look here, blood pressure medication, cholesterol medication, that's supposedly actually to help you decrease your risk of heart diseases. But the problem, when you start to have magnesium deficiency, that will actually increase your risk of having heart diseases, because magnesium is actually regulate your blood pressure. It's actually energy production and decrease your the risk of having cardiovascular diseases. So if you taken these medication for a very long time, you might need to take magnesium in a different time. Make sure you consult your doctor so it does not interact with those medication. The fourth reason is extremely important. That will tell you how much magnesium you might need. So based on the NIH, that an adult body contain approximately 25 gram of magnesium. So our body contain 25 gram of magnesium. Here's the link for it. Why this is important? Because this cause is actually connected to the fifth cause, which is approximately 30 to 40% of the dietary magnesium consumed is typically absorbed by the body. This is a sad news actually, because if you have 100 milligram of magnesium in the nuts or seeds, your body absorb only 30% of that, so 30 milligram. But approximately our body contain 25 gram, which actually this is very important to understand. 1 gram is equivalent to 1,000 milligram. So 25,000 milligram here of magnesium in your body. But when we start to look at our diet here, you will see the sources of magnesium from food. I highlight this or circle it here because this is in milligram. So the highest source of magnesium, pumpkin seeds, nuts and seeds, chia seed, almond, spinach, greeny leafy vegetables, and nuts and seeds. And when you look here, pumpkin has high level of magnesium. It's 156 milligram. And going back to here, your body only absorbs 30 to 40% of that. So you're barely getting 50 milligram, if you're lucky, from the pumpkin seed if you eat 1 ounce. But if you add to that, taking some drugs, that 50 gram will decrease more. Then you add to that the American diet, you're really gonna decrease that percentage to be lower, which means even though you think you have 156 milligram, you're barely getting a few milligram. And looking back here that your body contains 25 gram of magnesium, that's mean you need to have enough magnesium daily for your body to function properly. So I put X mark here because I don't recommend peanut oil or cereal or soy milk or any soy product, and I will have videos on these. Make sure you click the subscribe button and the notification ring, so this way you will get notification regarding the new videos. So I don't recommend these not very good source of magnesium, but a lot of health issue could be related of consuming these products. So to conclude, if you combine all of these causes very high chance you're not gonna get enough magnesium, and that will lead to magnesium deficiency. So what should we do? What to do to improve your magnesium function? I will go back to the other slide. I had it here. Magnesium is about 1% of the blood work. We usually do a blood work, but that test is not very sensitive. And we have to interpret it differently and have a narrow range of magnesium. Even if you go have a blood work for your magnesium, it's gonna show up normal because that test is not sensitive. So we have to look at narrower range than the one in the lab work. So we usually recommend magnesium supplements, especially if you have a musculoskeletal issue and you start to have those symptoms and your body's not healing, and you really have a lot of these cause or risk factors for having magnesium deficiency. Usually the recommendation to take magnesium. Not all the supplements the same. There's some magnesium supplements that actually not absorbable in the body. I will go over that in other videos. But the recommendation is to do a lab or start taking the magnesium, but it's better to work with a healthcare provider to figure out how much magnesium you really need in relation to your symptoms and your diet. One of the things you can do is actually take advantage of Ask ASTR. This is a free online medical evaluation that takes about 5 minutes, and the system will let you know the possibility of having magnesium deficiency or other deficiency. If you need a lab, it will tell you what you need to do to really take care of your health. The good news is actually it's a comprehensive evaluation that includes at least 7 to 9 healthcare provider database. So it's not gonna test to check your magnesium only for cardiovascular diseases, for other health issue, and it's totally free. So take advantage of that. If you have any question or comment, leave it on the bottom of this video and I will answer it in a future video. Make sure you subscribe and click the notification button to get notification regarding new videos. All right, we'll see you soon in the next video. Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below or go to astarinstitute.com.